We'll talk more about chemoderivation with dystonia in the future. Let me give you a couple of things to remember about dystonia. Number one, do not forget about levodopa trial in dystonia. So dystonia can be from Parkinson's disease and may respond to levodopa 60-70% of the time, like we talked last week. Dystonia may start as the presentation of Parkinson's disease and is very levodopa responsive in that scenario. Dystonia is very common in young onset Parkinson's disease and very levodopa responsive in that scenario. And then there is this dopamine responsive dystonia, DRD, or Sagava's disease, or DYT5, that is extremely responsive to levodopa. The DRD or Sagava's disease typically present as a generalized dystonia, and usually not a cervical dystonia, usually a limb dystonia, and usually in teenage years or younger patients. However, it has had some unusual and strange presentation, but classically, the dopamine responsive dystonia is exquisitely dopamine responsive, meaning that a half a tablet a day of levodopa may be enough to completely cure the dystonia. And so if you're going to check for Sagava's disease, use very low dose of levodopa. So half of 100 milligram tablet or 50 milligram levodopa once or twice a day may be enough to just get rid of the dystonia. But lastly, why levodopa should be used for dystonia is that many dystonias, including focal dystonias, even when they are not dopamine responsive dystonias, the genetic DYT5 or Parkinson's dystonia may still be responsive to levodopa, although now the response is much less and at usually higher doses. So maybe at 300 or 400 milligram a day, or maybe 600 milligram a day, they can have a 20 to 50% of a response of improvement. And that sometimes is useful for patients, especially for generalized dystonia where you cannot do injection on the whole body. So you have to select to do injection in some areas, and that may be easier to do when you can treat the rest of dystonia with levodopa. So always think about levodopa trial. The one condition I typically don't try levodopa anymore is focal dystonia of neck. Cervical dystonia is extremely unlikely to be levodopa responsive or DRD. And then blepharospasm, I typically also don't try levodopa. Tardive dystonia, typically levodopa has no benefit if it's induced from dopamine blockers. But in general, if it's a limb dystonia or if it's a generalized dystonia, hemidystonia, multifocal dystonia, I will very likely do a levodopa trial before doing chemoderivation. And then chemoderivation if levodopa trial fails. I usually don't try too much other medications, but you can try, oh, by the way, one anticholinergics work very well for dystonia. So cogentin and trihexyphenidyl and amantadine may respond to may treat dystonia. Especially, I've had good luck with amantadine in Parkinson's dystonia, not responded to levodopa, or I cannot increase levodopa. And I often try amantadine in those patients for Parkinson's related dystonia. All right, let's stop here. Hopefully you will find this useful and interesting, and write your exit ticket on it. 3, 2, 1, 3 things you learned from this discussion today, 2 things that you're still not sure of, and 1 thing you're going to go and read more about. And I'll see you on next Saturday. Bye.